that doctors know very little about. The condition stops the heart from relaxing, meaning the muscles become too stiff to function properly. Well, now researchers at 4 British universities are looking into how to diagnose and then treat the condition. Here's our science correspondent, Richard Westcott.
Around 500,000 people have a type of heart failure we know very little about. It's called HFpEF.
If you're ready, we can stop there. You have a seat.
And this is a new study to find out what makes it tick.
I didn't realise I had a heart condition, and I thought, why? I'm so fit. It can't be. I've been a dancer, done so much in gardening, etc. I couldn't believe it.
So you're quite good at walking on the flat, but maybe not so good on the incline.
That's
Is that right?
Yeah, definitely.
As well as the physical tests, they'll be asking patients about their lives.
If I was to say, could you walk to the shop and back again?
No, I couldn't.
This is a very interesting patient group who are very sort of much left to their own devices. There's not any evidence-based treatment therapies for them, so it's really interesting to try and find out what would help them.
It wasn't long ago that some clinicians doubted HFpEF even existed. It might be common, but it's hard to recognise. Symptoms can be similar to more well-known types of heart failure or even other conditions. There's a key difference, though.
A normal heart muscle needs to be able to expand and contract so it can pump the blood. Now, around half the people with heart failure have a muscle that's too loose, but they know how to diagnose that and they know how to treat it. The other half have a muscle that's gone thick and goes too tight, and that's the one they need to find out a lot more about.
This is one of the more obvious signs we sometimes see. This blue jet that you see here is blood leaking back because this valve should be closing, but it's not, and that can occur because the heart muscle has become thickened. We know that there are things that we can do for this group of patients, and it's just ensuring that there's a systematic way of diagnosing and managing, that people are more aware of it, and that they know that, right, if we get their blood pressure controlled, if we control their diabetes, if perhaps we make sure that they're doing more physical activity, that we can actually improve them.
Researchers will study around 200 patients for a year.
Well, I hope they find the reason why we go downhill like we are. And I'm quite pleased, actually, that I had that call from Faye last year when she asked me would I come and participate in research, because it must help the future.
They'll then recommend new ways to identify and look after the hundreds of thousands who suffer. Richard Westcott, BBC News, Cambridge.